Hi, this is the second part of this discussion about communication with individuals who have mental illness. And we talked a little bit about the background, we talked about stigma, but now I think it's important to focus in on considerations about the differences in others as well as how to hone in on those communication skills. So I think it's really important that we spend a moment to identify and recognize some minority scenarios that can influence outcomes in people who are experiencing mental health concerns, as well as their risk relatively of experiencing those concerns. And the big pieces here for sure are sexual minority groups as well as ethnic or racial minority groups. So when we think about sexual minority groups, there's not a whole lot of data when it comes to people who are transgender or gender diverse individuals, but we do know that they have a lot of similar potential influence when it comes to things like the minority stress model, where there is potential for lower or poorer health outcomes, increases in risky behaviors such as substance use, and a fear or reduction in seeking of appropriate care, both mental health care and physical health care. In addition to that, other members of the LGBTQ plus community who are self-identified experience greater rates of discrimination. And individuals who are of a sexual minority that have experienced discrimination do report higher rates of substance use, lower rates of mental well-being, and a lot of times more difficulty in engaging in their health care. Adolescents in particular are a concerning group when it comes to sexual minority groups, where this is actually the space with which we're seeing the greatest increase in rates of suicidality, suicide attempts, and death by suicide. So those individuals experience a lot of hopelessness, a lot of suicidality, a lot of substance use in comparison with a non-sexual minority sort of comparator group. So they had a higher risk of negative outcomes associated with mental health. And that's something to be aware of when you are talking with individuals. In addition to that, we have racial and ethnic minority groups. And I've broken this down into a couple different things. This is kind of taking culture out of the context because we'll talk about that a little bit separately. But individuals who are BIPOC are disproportionately affected by lack of access to quality mental health care. And this compounds with a number of different challenges. When we look individually at Black Americans, individuals who are Black Americans are much more likely to experience disciplinary actions at school, including things like suspension or expulsion, which can cause isolation and cause trauma as well as shame. We see more instances of isolation, physical as well as social isolation, in our incarcerated population as well, which have a disproportionate amount of Black Americans. They have increased exposure to social isolation and solitary confinement, which can result in increased mental health problems. And we see greater rates of violence and adverse childhood experiences a lot of times with individuals who are Black Americans. Now, we're talking in generalizations. This does not apply to everyone who's a Black American. I want to make sure that is very, very clear. Not all people who fall into these categories will have these experiences. They're just more likely to. In addition, people identified as multiracial are going to have a greater risk of experiencing and reporting mental health challenges, even when compared to things like Alaska Natives and Black Americans. And then a group that we always want to be thoughtful about, it's a more general group, but refugees as well as immigrants and asylum seekers, they have what's sometimes called as the healthy immigrant effect because of a lot of the screening processes that go into place for entry into a new country. However, as time progresses, those individuals will often meet, or in some cases with specific diagnoses, exceed the rate of the general population in certain mental health concerns. Particularly, we see consequences of social isolation. We see consequences of experiencing of traumatic events. So, especially if they're seeking asylum from a disrupted country, then a lot of those things that they may have experienced prior to entering the United States are going to potentially cause some negative outcomes that can happen. And really compounding that with a fear of reporting and seeking treatment for those conditions due to a fear that it can affect their outcomes in housing and in jobs and being able to stay in the country and stay feeling safer when they are feeling at risk of going back to a disrupted environment. So these are all really important things. In addition, we have to think about the types of symptoms that someone might be experiencing if they have mental health conditions, especially if they're experiencing a mental health crisis. So some challenges that you might come across while you're communicating with people who are experiencing mental illness can be from their symptoms of withdrawal. If they're using substances such as alcohol or opioids or stimulants, for example, and they're in a environment of abstinence, there's going to be some physical and psychological effects of withdrawal from that or those substances. We also see emotional withdrawal and emotional isolation from individuals who may not express how they're feeling and be much more difficult to communicate with. People can also experience a lot of irritability as a diagnostic criteria, essentially, for a number of conditions, including anxiety and depression, where they're more irritable. They're much more quick to feel irritated or to be, less understanding than they typically would be as a consequence of what's going on. People can experience perceptual disturbances. So if someone's experiencing psychosis, for example, there can be a significant difference in what the agreed upon reality or scenario that's going on happens to be. And that can result in things like fear. People can be afraid of you if they feel that you are trying to harm them. Even if you aren't, that's their reality potentially. People can also be very preoccupied or distracted, so they may have difficulty processing information, holding on to information, relaying that information, which might require some patience in order to communicate. There may need to be multiple forms of communication and reiteration of that information. And some individuals will also experience challenges with being socially appropriate. So if someone is very depressed, if they have autism, if they're experiencing a substance withdrawal, if they're psychotic, they may have difficulty picking up on social cues. Social cues can be very challenging. We also have cultural and societal differences there too, but that's for a different part of this discussion. So being patient, once again, and realizing that sometimes people will have difficulty in picking up what may feel like a very natural understanding to you of what is socially appropriate in that moment, whether it's eye contact, communication style, volume, expression. Any of those kinds of things can be misinterpreted or misapplied in those types of scenarios.